live.
Oops.
I got a couple minutes, that's fine. Get it in a little earlier. I've had a couple complaints. It takes 5 minutes to get in on the tail end of the first subject before they get in.
We saw you. Hello. Oh.
You want to go Friday or you want to skip Friday?
She said she's gonna have a declaration on by the end of the week.
Yeah.
So it's up to you as to what's announced.
You want to plan on Friday at 1? Or does that
Let's plan on it. and,
Because they told us they saw the first draft of the declaration.
For this week,
For what she's gonna be announcing, but they didn't really,
highlight it.
it has campgrounds in it. That's all that I
I
know.
figured that was coming because Memorial Day's there. Yeah.
Something about, that's the only thing that they let us.
So we'll plan on the 8th then at 1. I hear differently.
All right. Thanks.
Yeah, this is anybody's guess. Numbers are down again.
Total. Yeah, look good.
Mhm.
Starting to really come around.
I think our county seems to be peaking now. Like, it seems like, we had one case forever and ever and ever. And then now we're getting trickles. It seems like
Yeah.
one here, a couple here.
You said the 6 or 7. I knew you guys had changed that. So we're getting pretty close to that window. Could be clear out to the 13th if possible.
All right, it's 1.
All right, go ahead and call the meeting to order. Does anybody got anything they want to add to the agenda? Okay, hearing not, I take a motion for the approval of the agenda.
I'll move to approve the agenda.
Second.
Okay, we have a motion and a second. All those in favor say aye.
Aye.
Aye. Okay. Minutes, and the minutes will be from
May the 4th.
May the 4th. Our regular meeting. I did read through them. They looked very good to me. It was very complicated minutes, especially towards the tail end of the day, but they looked good to me. Unless So I would make the motion to approve it.
I will second that motion.
Okay, any more discussion on that? Okay, call for the vote. All those in favor say aye.
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 And opposed? Motion carries. Minutes are approved. All right, Sarah.
So we had a conference call this morning. 2 new things were announced, that the PPE for elections is being sent out. There's 18 different drop sites. So they're going to let Courtney know where hers is, and they will make all deliveries by May 20th. So to be looking for that. They're also sending out PPE packages to every single nursing home in the nation. This is not a state thing. This is a FEMA thing. So FEMA is going to send out the first 7-day supplies that every single long-term care needs this week. And then they will get a second PPE care package from the federal government in the first week of June. So that was a new thing that no one knew about. FEMA initiated it. nothing that any of us need to do. Carrie and I are getting another order of PPE in tomorrow, and it looks like we're getting 1,000 gowns, which is exciting because we've never gotten 1,000 gowns. We've gotten 100, we've gotten 90. The last time we got 400. So what we're going to do is we got some goggles in, some safety goggles. We're going to give every single nursing home long-term facility like our own package of safety goggles, the face shields that are done, and the gowns, so that everybody can be on board if they have to isolate any sort of patient in the long-term care. I believe they announced a few more long-term care facilities, but they were in Eastern Iowa again that are having the outbreaks. So the closest one to us is in Granger with the long-term cares. So it's kind of our priority to keep that older population safe and keep the long-term cares with PPE that they're requesting. So we put in another request yesterday and it's coming tomorrow. So they sent out a survey this morning. I've got to send that out to the Smithfield. And then I also have to send it out to the 911 center, law enforcement, fire, EMS, anybody basically that are working in, and they're wanting to know how many cloth masks that they want to send each county. So that's the next thing that they're working on, are cloth masks. We talked about this at the last meeting, that the federal guidance says that the packing plant should be using the N95s, but the state guidance says that they should be just using the cloth masks. So maybe it's going to be a combination of both. I did get an email from Smithfield yesterday, one of the head people at corporate, and he told me that they were okay with PPE, but they were wanting our list of suppliers so that they have backup contacts in order to order additional PPE. So it's nothing they wanted the county to do. They were just wanting to know who we were having luck purchasing PPE from. And again, that's everybody's competing against each other when everybody's sharing the same list. But it seems like we get a couple new emails every day with new people saying, hey, we're able to provide PPE now. So I do feel like that problem is kind of resolving itself somewhat. I don't know. We had a little bit of an issue with the hospital not getting additional testing supplies, but I think that got itself worked out this morning, and the hospital should have additional testing supplies by Friday. With the hospital in Carroll setting up the drive-through clinic in Denison, it was always, well, Carroll County doesn't have very many cases. Well, that's what I kept trying to explain to them was, yeah, we only have 5 cases. However, we are doing the testing over in Crawford County at the St. Anthony Clinic located in Denison. So it took me about 5 people. I finally got somebody who is going to close our case and get St. Anthony's the additional testing supplies that they needed because they were going to be really close to running out on Friday. So that should be resolved as of this afternoon. There was a request for the state to put in a strike team, what she calls strike team, these task force over in Crawford County. We were told that the strike team conversation is always changing. No one really understands where the governor sends these strike teams. They were setting up a 5th Test Iowa location. The priority is never chosen by the locals, it's chosen by the state as to where they want to set up these strike teams at. So Crawford County is on their radar, but they're just still not seeing Crawford County as any sort of threat that they need to mobilize over here. Or if we were to see any sort of testing happen in Crawford County, it would at the earliest be Monday. So I got an email this morning asking if we could help push for nursing support down in Audubon. So that email is circulating up at the hospital. Audubon is seeing a big shortage or a big need for additional nurses right now. So they were wondering if St. Anthony Hospital has the ability to send nurses their way. So I don't know what's going to happen with that, but we saw that email this morning. So
Sarah, what is the criteria if someone wants to get tested for COVID-19?
well, the criteria is if you're exuding the symptoms that they're stating, the fever, the cough, the chest tightness. If you've been like living in the household with someone that is like, if my husband were to have it, then I'm living in that household. But I did reach out to public health and they did not test the case number 5 does have a roommate and they did not test that person. They said they're not going to test that person until that person would have symptoms. So I guess the testing guidance is all over the board, Neil. The Test Iowa site says that if you've been exposed to someone or if you're working in that medical field or EMS providers, like I know Daryl's crew transported a patient. Daryl said that they wore full PPE, but if they would go on the Test Iowa site, it would probably tell them you qualify for a test, but that's if you're willing to drive to Waterloo, Des Moines. They're setting up another one in Dubuque. So all of the testing sites are on the eastern side.
When they get that set up.
They said if they do something in Crawford, it would be a hybrid of a strike team / Test Iowa site because they wouldn't probably send a full-blown strike team over there. So it's probably one of the most frustrating thing, Neil, because exactly like what they said, it changes daily. So.
Okay, thank you.
So Sarah, some of the Test Iowa survey individuals who are not showing symptoms are also getting tested though, correct?
Yes.
Go ahead.
But if let's say 3,000 people filled it out and 1,000 people qualified for a test. Well, if they only have 250 spots open, they then prioritize that with the people that have symptoms. So even if out of your 1,000 people, 250 have symptoms and 750 were just related to the EMS, nursing, medical world, and the test told them to get a test, they didn't then meet the second cut to get an appointment for a test. Because on the Test Iowa site sends people, okay, you can show up at this location at 10 o'clock.
But they still have to show symptoms though, correct?
They have
Or
to
not.
show symptoms, or the Test Iowa site would have to have openings. So it's however many people had filled it out at that time, and then it's going to prioritize it a second thing to fill the appointment spots. And then, so let's say you had symptoms, but you didn't get a spot. Then they're telling you to call your local provider and work with your, McFarland Clinic, St. Anthony doctor to then get the test at the local level. So like she said, it's a tool in a toolbox. You can try to get your test with the Test Iowa. If you don't get a spot with that, then you would go and still contact your local provider.
So if you're one of those 200, is it your discretion to get the test, or are you asked to get the test, to take the test?
If you filled it out, obviously, then I would say you want the test. And then if you get an appointment,
Okay.
I would hope that they would show up for their appointment and not be a no-show with such limited appointments anyway. So it's the compilation of the data is going to pick out, in my opinion, the top 250 that they have spaces for. And I'm just throwing that out there. I have no idea how many appointments they took. I just knew they took 250 appointments on the first time it was opened.
So are the tests hard to get? Are we still having problems getting testing materials?
Well, the hospital was running into like a brick wall, but that got resolved this morning. So the hospital should have their testing supplies replenished by Friday, but they had not run out yet. No, they had not run out.
But I mean, it's still, it's just that close though. I mean, you know, I mean, if we had a surge, would we have adequate amount of testing supplies?
Manning is allocated 25 tests per week. So, I mean, it's not like they have 200 sitting, they have 25. So if you had a surge in one day, Manning would have to, let's say they had 30 people show up on Tuesday, Manning would be out, and then they would have to have a courier grab more tests from the state hygienic lab and then get them to them. But so far they've been holding their own, she said, and the 25 per week seems about adequate in Manning. St. Anthony Hospital started with around 200 tests, but that was 6 weeks ago. So they are now at the end of their first set of allocated tests, and they're being restocked by Friday from the state hygienic lab. So it's still a requesting process that you have to go through to get your next set sent to you.
Okay, on the other PPE, are N95 masks and surgical masks still in short supply for hospitals and for first responders?
Well,
because I've heard they are. I've heard that people are still using the same mask for over a week.
Here, I don't think here we're using the same masks for over a week. It might be somewhere else. The hospital administrator with Manning and I talked this morning, and she had just gotten an email sent to her by Mercy. So Mercy is trying to do bulk ordering for their Mercy constituents. So she was seeing the same prices that me and Carrie are seeing. And that was 71 cents for a surgical mask at the 100,000 level. Well, Manning Regional Hospital does not need 100,000 masks. So they're kind of like in this buying group with Mercy to see if they can even get the 71 cent price. So for something that generally costs 15 cents to 25 cents before, it's still 3 times the price. You can get it. It's just what amount of money are these facilities willing to pay for the PPE? Some of our other long-term cares are ordering their supplies on Amazon. They just keep getting that it's in process. It's in process. It's in process. So they have orders in, they just haven't shipped yet. So but I mean, nobody's run out of that. We were able to ask for stuff from the state and we were able to get that. So we're getting another 2,000 surgical masks tomorrow. So if St. Anthony is struggling to get it, then we supplement it with the stuff we received from the state stockpile. But you have, on the call this morning, they said that there's like dentist's office trying to open and they're having a problem now trying to get it. So with the elected surgeries coming in the proclamation, it states that they have to procure their own PPE. So like a dentist's office cannot call us up and ask us for PPE. So they'll be paying that 71 cents to $1 per mask from whoever they find them from.
Courtney, how did the voting go Monday and Tuesday and this morning?
We haven't had anybody try to vote in person, but we're inundated with mail out ballots. In 2016, we had about 200 absentees that we mailed, or I'm sorry, 200 absentees total. We're well over like 1,400, 1,500 today. So
That was the first day.
well, yeah.
Is this a result of the Secretary of State mailing?
Yes.
Thank you.
the girls are being a little overwhelmed right at the moment. They're working pretty long days.
What is the situation on getting plexiglass for the countertops in the courthouse?
The sneeze guards are, some of them are here, most of them are installed. We're gonna have to make a couple adjustments and then a couple to be finished up, but we're hopefully maybe by the end of the week, we should have those in place where we think we need them.
They're using plexiglass at the post office, so that might be pattern to follow. They have a similar workings in that they work with public as we do as well.
These are hanging, they're hung from, and they should be able to move the curtains open and shut without taking them down. They just stay up.
Yeah, these I think are on stands.
Okay.
So Sarah, question on the numbers. Where, there was an outbreak in Perry at the Tyson plant there, and there was 700 tested positive. Is that correct?
Yes, that's correct. Most of the people are asymptomatic though.
Okay, so it doesn't show up as a number. Is that what you're saying? I mean, I thought if you had a positive test, it would show up on the daily numbers.
They were saying, I believe that Dallas went up to 613, was it? But so it's not at 700 because several of those people don't live in Dallas County. So
yeah, but I mean, the total numbers don't come up to that. I mean, we were down today 249, and we didn't have a big number yesterday. I think we had 500. What we had 500, I believe.
Yeah, the Dallas map jumped yesterday quite a bit, and then even today, I have no explanation why the number is 293. So no explanation, because they said that there was a backlog too that was going to take this week, and there was a minimum of 1,000 pending cases in the backlog, and that was announced on Monday. So you would have thought we would have seen that, unless there's just that many negatives. But I can't seem to find the negative information anywhere unless she announces it. So I've looked in all of the columns and I can't find that number. And Channel 13, Channel 8 don't post the negative either unless she states the negatives during her press conference.
Did you ask Colby about that, Sarah?
No, but I could send him that email now that I got his email.
Anything else for Sarah? Any more questions for her? Sarah, you got anything else you'd like to attack?
So a lot of people from both companies, city, and county workers have questioned the vacation and where the county stands on if somebody leaves and then they come back. So if you follow the nationwide map, I mean, Iowa used to be in the bottom third of the states, and now Iowa is probably in the top third of states with the cases. I think we were 32nd, or sorry, in the top third. So the argument, I guess, is if I go to Hawaii where there's only 642 cases, am I not better off than being in Iowa with 10,111 cases? So they're wanting discussion on the guidance for if someone were to leave and go to a state with half as many cases as we do, what the reasoning is to self-quarantine at home for 14 days, which it's a solid discussion to have.
Well, in that discussion, we should include the fact that when they're out of their home, they're, increasing their exposure, period.
Mhm.
They're in hotel rooms, they're in aircraft, they're traveling. You know, don't know what or who you're in to come across along the way, much less controlled environment than our own community and homes.
Yeah, I agree with you there, Neil. I think probably the biggest concern I'd have if they're traveling a long distance, that on that airplane and that air is just recirculated air in there. That really does concern me. And you get in tight, confined areas in the airports. You know, you may be going to a safer place, but it's that area in between there that you're traveling through that bothers me.
I would agree with that.
Well, and they seem to be changing. So the CDC guidance is also, last week we heard to wear the masks, and this week they're kind of backpedaling on that with wearing the mask, because you can kind of take your own viruses and bacteria and cause your own problems with wearing the masks. So it'll be interesting to see what the guidance is closer to May 15th, because the CDC seems to be backpedaling on the mask. So here we're gearing everybody up, and even the state's gearing everybody up to wear the mask. And now they're saying, well, we don't know if we want you to wear the mask. And it's we're constantly chasing the guidance, I guess. We're chasing the guidance. And then they're also stating that if a person is positive, but then they don't show symptoms for 7 days, they're allowed to go back to work with a mask. So even in all these meat packing plants, if they're testing 700 people that are asymptomatic, as long as they don't show symptoms for 7 days, they're telling them to come back to work.
Without a test?
No, so they tested positive.
Right. I mean, without a test after the 7 days.
Oh, they're not retesting people after the 7. No, they're not.
They're
like,
not.
I know in China they did that. You had to be like, I believe 21 days. I think they did 3 weeks, and then they were doing a retest. And if the people didn't test positive, then they allowed them to go back to work after three weeks.
Right.
So they're not retesting.
What is our thought today on a date for reopening the courthouse?
Go again. You got cut off a little bit there.
What are we thinking today on a date to reopen the courthouse?
Well, that becomes with more discussion on the PPE first.
Okay.
Do we have enough sanitizer in this building to last us with a full load of people? Do we have enough gloves for this courthouse for a massive group of people? Do we have the cleaning spray, the bottles, the masks that we need if we so choose to put a mask order out that can't come or go without
We
a
have
mask?
masks. No, we have our masks.
Is Zach in the room?
Are those all the things?
No.
Do we have those things that we need? And that's one question that I have. You've got to satisfy all of those pieces before you can even think about moving.
We talked to Zach yesterday. He said he's got quite a bit of sanitizer, but then as soon as we start using it, you know, he needs to
It's gonna go
get the
fast.
second supply. He's got 5 or 6 of the hand sanitizing stations that he is going to mount on the first and the second floor. I think he was going to try to put 3 and then maybe 2 and then 1 in the basement. He has that on his list. He said he has some of the refillable bags for the hand sanitizer. So we told him to, you know, put his order in. He said that he's been getting supplies. So we have the masks. We're getting quite a few gloves in tomorrow. So
Okay.
not that many people
This
had
is
gloves
stuff
on their
is-
list though.
It's easing up on
Yeah,
some of the,
not,
okay.
and even Dr. Heim, so she's been in on several of our conversations because we're giving schools guidance on outdoor graduation ceremonies. Even Dr. Heim said she would rather see people use sanitizer after every transaction than try to mess with gloves. So that's been her
Probably true.
guidance through the Board of Health, is not pushing the gloves, pushing the hand sanitizer. Cookies barbecue sauce up in Wall Lake is making it, so Carrie and I are reaching out to them next. You can buy it at Fairway from that Bountree. They were a distillery over in Eastern Iowa. Fairway has that in the gallons here in Carroll.
Okay.
So,
So the sources are starting to get better. everywhere. That's a good thing, because you just don't know how many we're gonna go through.
yeah, the biggest thing was, so we have maybe 6 refillable bottles for the hand sanitizer. So we were gonna put an email out, county worker wide, if anybody has, it was about like a 20-ounce bottle with just a little squeeze pump. Not the one that makes it into foam, just the regular. If anybody has one of those at home, that they can just bring it, because we can get the refill. It's just the little bottle that people can, that thing is impossible to find. So we have, I believe, 6 of them. Just need to find, so if Courtney wants one at her desk and Jean wants one at her desk, so that the people can just pump it like you see other places. We're able to get a gallon pump, but do we want to put a gallon out and then use that great big pumper? It's just nicer to have that in between size. So you can find a couple more bottles for the offices that want to just be able to transaction. You're seeing that at more businesses. In between everyone, they just put the hand sanitizer on.
All right, now circling back to your question then, Neil, because one of my biggest beefs was that we need to get all the safety things in line first before we even think about it. And I think we're in pretty good shape there. We even talked, Courtney and I and Zach had a conversation about marking X's on the floor. Because we didn't want to put down something that's going to cause him a problem or a heartache down the stretch on that travel floor. We really think that maybe paver's tape probably will work as something that's easy to replace, and it won't leave a big residue, and he thinks that shouldn't bother too much. Steph, you got any, you've cleaned a lot of floors, you got any chime in on that? Can't see it.
Since he did the grinding on the terrazzo floor, I wouldn't recommend putting tape down. But there are, so Crown Matting Technologies, they have come out since COVID. They came out with these mats.
You're breaking up.
Can you hear me?
Yeah, you're breaking up, but go ahead.
I'm gonna send you guys this email with some matting options.
Okay.
That Crown Matting Technologies came out with, and they have them spaced 6 feet apart. I would not recommend putting tape on a ground terrazzo for how much investment and in time Zach has put into that floor.
I know, that was my concern, is the damage. We even talked about, Courtney has that she uses at election sites. You can put a sign that's probably an 8.5 by 11 in the top of the cone. There's slits in it so it'll slide over. So we can drag those out. We just need to get the signs made, and we think we may have a path for some of those to be made. So that might be an option. Then those can just be picked up and moved fairly easy. They just sat on the floor. So that was the only option that we had talked about, was the tape. He wasn't too concerned about it, but I don't know if he was 100% sold on it. So
I can look into some pricing.
yeah, would you do that? Let Zach know, and we'll look at what was her name? Bowles. Bowles.
Oh, Susie.
Susie.
Yeah.
Said she could make those signs.
Well, I think Emily, she talked to Emily and she said she had a Cricut. And Cricut can create
Okay.
a lot of.
And see how much it would cost to do
Yeah.
a number or two. Yeah, just, anyway, just kind of just give us,
Well, and I didn't talk to her, but.
give us an option.
Through the grapevine.
So I did my 16-year-old's license today at noon. A lady called me. I had an appointment, and she was actually from the Muscatine courthouse. So the DOT station in Muscatine. So She said that she heard that they don't have plans to reopen the DOT offices that soon. And that the guidance that they were hearing in Muscatine at that courthouse was 40%. They were limiting capacity to 40%, really pushing the by appointments only. So even if you open, Neil, you can still say we're open, but by appointment only, and really limit the number of people coming in the courthouse.
So Rich, what did you say? What did you say about the clerk of court? They're not opening up until the 1st of June, correct?
I think that's what we've got that email on that. I was gonna ask that question.
June 1st.
June 1st.
June 1st, right?
Here's the,
So do we have any, do we have any pressing issue to actually open before then?
no, but here's what I would recommend, and this is just my thought. Election's June 2nd, right? Election day is June 2nd. We don't want to open up for election day. We want everything to be done just like what we've set in path. So if we do open, to look at the third on a Wednesday, and we could do a soft opening on a Wednesday, Thursday, Friday, and get a feel for what's going to happen to us. And we can do the appointment by appointment only. We can actually, you know, the assessor and the recorder's office, they can trickle through there because they don't see a huge volume of people. They may write the first day, but I'm guessing that they'll not see that big a volume. It's the treasurer's office is what we got to watch out for. And we've removed the chairs too, because we're going to limit them to, and that was one of my questions last week. Do we count mom and the child trying to get a moped license as one because they've been living together, or do we count them as two-person?
Two, but they can still be on the same square
Okay,
X.
because if you allow one, then you can really get a lot of people in.
Yeah.
I think you count each person, but as far as like your distancing, you know, the two people are in the same
Okay.
household, they can stand next to each other.
And I think we really should look at watching, keeping that lobby down for a little while. We'll know more in 2 weeks too, because that's 2 or 3 weeks away.
Well, and I sent Gene an article that was in the Farm Bureau of what Plymouth County is planning on doing as far as driver's license. And I think that's a good model to look at. I'll send that all out to you, or do all of you get the Farm Bureau paper?
Yeah, I got it. I saw it.
Do you get it, Neil?
I get it. I didn't see that particular article.
Stephanie, you get it? Okay. Well, then I won't just look at that. I think that's the one thing we got to look at. And that's the guidance as far as, you know, trying to control particularly that driver's license part. And I think we if she gets that second station up, that'll help us alleviate and process people a little faster. So I am not too crazy about doing anything yet at this point. I think when we do it, I do think we need to limit the number of people coming in there. And Gene was telling me this morning that there's one treasurer in the state of Iowa that feels that we've done things so successfully through this virus that they're kind of recommending they don't ever open up their treasurer's office to the public. That it'll all be done online. So you can visit with her on that. But
I did visit with her on that, and you know what that leads to.
well, and you got to remember that place is building a new courthouse, and they had to downsize it, so they're probably going to look at cutting some offices.
Well, the only county that I know that has attempted to open up is Webster County. Has anybody heard that? And they're not doing very well, and they're thinking about closing back down again. So
I'd like to proceed slowly with this too, because people are used to us being closed. I'd hate to reopen and then have to close it back down again. I prefer going slowly, especially with motor vehicle and taxes, things that we've proven that we can process through the mail, online, or through the Dropbox. Now, driver's license, of course, is a different beast, but There are several counties that are looking at the appointment only, Carroll County included.
Mhm.
But until we get everything in place too, I'd like to proceed solely on that.
Well, and I agree with that. I'd sooner see us do it right than have to back up and restart everything.
Yeah, that lady said that's all that she does is the 16-year-old. And she's doing it through the phone. It's super easy.
We have heard that DOT is discussing the possibility of continuing this for future practice, not to reopen to the general public, but to proceed with appointment only from here on out. Which, if you've ever been in some of those large DOT stations, you see what makes sense.
Mhm.
Rather than taking a whole day off work to go get your driver's license and sit there all day, you'll come in by appointment, get your work done maybe within an hour or two at the most, and be on your way. So they're even looking at it too.
I did see also at noon that up in Wisconsin, when people are taking a new test for a new license, the kids, that if they're met certain requirements as far as training and driving and stuff like that, and the parents feel they're capable of driving on their own, they're not having them go out and do an actual drive test anymore.
I don't know about that.
I question that too a little bit.
That scares me a little bit.
Mom might just want to get him a license to get him out of the house.
We have a lot of 15-year-olds on the road by themselves right now with school licenses.
I say if they do driver's ed and they pass driver's ed,
Well, that was one of the part of they had to do is put in so many hours driver's ed. They had to drive so many hours behind in the car with a teacher or whatever. There were some requirements. They just didn't get it handed out. But
Yeah, you have to go back 5 times.
if the parents thought they were capable, they were letting them do it. And after they had those
Holy cow.
requirements,
Especially if you have no tickets.
Well, kind of going back onto the conversation, and we told everybody we're gonna revisit it maybe the 15th, which is a Friday. And I still think we look at it at that point. But like I said, with the election in the first part of June, I don't want to confuse people that, yeah, you can all come in one day and try to vote.
well, I'm not worried, if you said, oh, we're gonna do it June 1st, at that point, people have already voted. If they're gonna vote early, most people have already voted by June 1st.
Right.
And they don't vote at the courthouse on election day anyway. So I'm not too worried about like a rush of voters, because
Even with one polling place, you would.
not with almost 1,400
I know,
absentees already.
I know, that's
There's
just
not gonna be
amazing.
anybody left to go to
To
the polls to
vote.
vote. But
Okay,
And it's only May 6th.
yeah,
I
yeah,
haven't sent
so
mine in yet.
I'm not worried about it there being a rush. We haven't had nobody at the window to vote, and that was promoted that we would be open for that.
well, let's just leave it at, we're gonna revisit it the 15th or the 13th meeting. And let's just revisit the 13th meeting and then we'll know. It's only 2 days difference.
Yeah, because we got to see what she's saying in this new proclamation.
There's lots of changes coming probably this weekend.
well, and I just caution that we make sure we have our plan in place of how we're going to handle it on opening. And if we're going to do a partial or soft opening or whatever, that we make sure we've got that in place and that's what we follow.
But I'm not.
I don't want to have us restart up again.
The only office I'm worried about is the treasurer's, because that's where the heavy traffic's at. Yeah, I think the recorder, they could see some, and Courtney certainly will with the election, to be questions and things like that. But I don't think it'd be out of the ordinary, I don't believe.
Well, my concern is, we have people tell us how big the courthouse is. Well, when we're dealing with this subject, we can't deal on that whole square footage of the courthouse,
Well, and
because most of that business is transacted within the lobby windows, which is a very small space. That's the space we have to work with. I think that's the space that we got to control. I think we're going to have to control the number of people that come in there at one time.
And that's how I addressed that letter that we all got is, the courthouse space is one answer and the lobby space is a different answer. So
That's the way I addressed it too.
And working parent, busy parent, I'd rather have an appointment. I've had to pick mine up from school early and wait. I'd rather have an appointment. I was in and done with his license in 15 minutes, having an appointment today.
okay. You guys got any input, Ashton?
So with the vacations, we're gonna,
Oh, the vacations. We did not answer that one
people
yet.
leaving.
Well, right now, it says we say no. In the policy
I
that
know.
they pass, it says no. 75 miles, I think, is the limit.
Did we put an end date on that, or was that just a guideline?
Well, it's
Well,
just
I'm sorry, I step back. December 31st, 2020 is when it says.
the end of the year.
But it also says it's constantly changing, may be modified at any time, that type of thing.
And the thing that you need to think about though too, is we could easily be exactly in the same position that we are right now with no vaccine come Thanksgiving Day. So if you want to keep pushing those vacations, because people are, if they can't go 75, I'm going to push it back, push it back, push it back. Pretty soon, we don't have a room for everybody to take a vacation, even if it would be a local vacation.
Yeah, so then are you gonna pay out the vacation? Or
So
you
then
gonna-
it becomes, are you going to pay out vacation because you stopped everybody from taking them?
Or are you gonna let them, the day's over?
Or are you going to let it carry into next year and then you got someone that's got 10 weeks of vacation instead of 5?
I don't have a problem with people taking a vacation locally. I have a problem with people going somewhere else, and if they're scheduling a flight or whatever, and by the time they schedule that flight, things can change so much. That's the problem. Things can change so quickly, and
Say that the travel would be vacation travel, unessential travel will be
Limited to.
limited on a case-by-case basis, because you can have somebody that's got a trip planned to go to,
Tennessee for a
Okay,
70th birthday party
yeah,
for a grandparent.
or they want, somebody's gonna go to Colorado and go whitewater rafting or something, which is gonna be limited interaction with other people. They're driving in their car probably.
Mhm.
I passed up a trip today because it's more than 75 miles. I wouldn't have got out of the car but one time. And it had been in a cemetery. So I think I probably would have been extremely safe. But because it was a 75-mile rule, I didn't go.
Mhm.
I do have a trip scheduled for Las Vegas in October, and it doesn't scare me a bit.
Driving in your car, right?
Flying.
Flying.
I would like to see you revisit the policy that we have in place and possibly look at making that a case by case, whether you leave it up to the department head or if it's somebody that you have an issue and you can consult with Sarah and maybe a board member and say, are we going to do this? And I know one-on-one or doing a case by case basis may not always be fair.
Right.
But if somebody's going to Vegas and they're going to be in and out of casinos and
Yep.
around thousands of people and on an airplane versus somebody that might be going to a rural area and be around maybe 50.
If things are just like they are today, when I get back, you won't see me out of that house for 2 weeks.
So maybe we could talk about that too. Because
Mhm.
And as far as flying, the only thing I'm worried about is somebody getting on that has it. That airplane is as clean as it.
they're probably
They
cleaner
barely
than
can make
they
a
ever
living
have been.
right now. They don't want any more problems. So, do you want to revisit this again later? Do you want to leave it as such? Well, like I said, we're running into that vacation window where people like to go to Branson, Missouri for a week. Branson, Missouri got a lot. No, could have, not today they don't, but they sure could in a month. You just don't know.
that's the problem. There's too many unknowns.
Well, and
That's why it's case by case.
if you take the example of the corn processing plant in Glidden, that person, they went on vacation, they came home, they sat out the 14 days, and they had the symptoms 3 days after they went back to work. So they went to California, came back, sat at home for 14 days, took the test 3 days later, positive, so has to sit out another 14 days. So they did that according to, again, the guidance, which is always changing. And then that now the guidance is saying, well, even if you're positive and you have no symptoms, then you can go back to work after 7 days. So see, then they've taken the 14-day thing away from even somebody having a positive case.
Don't you see any questions either? Maybe a rough idea how many.
Because you could say something like, if you go, and then just everybody would have to be aware, man, if you wake up and you have a sore throat, you have that's where the sick leave's gonna come into play. You just have to hammer on the, if you feel sick, stay home.
20. Got that for you. Having better participation on this.
Does that make sense? Like if they go and you come, but then if there are any sort of, you get sick in that week coming back or that, I mean, you just have to call, you have to lean on that caution. And then people have to use their sick days. I mean, it's no different than if they went on vacation and then they come home and then you make them use 2 weeks more of vacation. Yeah,
Well, you get 2 weeks of COVID. No
But-
matter what.
Yeah.
but
you
it's
can't-
COVID if it's a positive. You get the 2 weeks of COVID if you have COVID or your spouse or a child and you
That's
have to
right.
take them.
That's right.
Yes, that's how the
that's right.
policy
You're
is
right.
written right
You're
now.
You travel for non-essential means.
Yes.
Right.
And you quarantine, you have to use vacation first, then any comp or personal time. And if you exhaust all that, then
Mhm.
you can get sick.
Exactly. They've taken the vacation, then 2 weeks, and then they get it.
Most people only have 2 weeks. It takes you till you're 30
Basically,
weeks.
so the majority of our workforce is probably 10 or less. Is not correct?
Mhm.
Yeah, well, you know, anybody that's been employed less than 10 years only has 2 weeks. That's a lot of people right now.
Right.
A lot of new
Probably have about now 90 days of vacation in our office to use up between now and so,
Mhm.
you know, look at that and we allow 2 people off, we need, you know, no more than 2 people off every day, because we need the rest of them to function.
Right.
So between now and the end of the year, if we wait till, like you said, Thanksgiving, there's no way
We can't get it done.
Mhm.
So we're gonna have to make a ruling on that sooner or later. Maybe we should kick it down the road another 2 weeks. Maybe we'll know more information.
I can put it on the agenda for the 13th because that's when we're going to talk about.
Well, I'll just make one comment about this, about the whole
Reopening.
coronavirus thing, and that is this, that there's hundreds of thousands of people who are disappointed in not being able to do what they want to do. And now, and I don't think there's anybody that's participating in this meeting doesn't feel the same way. You know, there's other things that I would rather be doing than I would rather, you know, I mean, I want to go to a ball game. I want to go fishing. I want to do, you know, so I think that there's, you know, we have to accept some of this as just the way it is as well. You know, I mean, they were talking about Universal Resort down in Florida and Disney World and that whole thing. You know, it's unfortunate. People would really like to go there, but they can't. You know, it sounds like they're gonna try to open those up on a limited basis, but, so I don't know. It's a tough call, and I get what people want to do. I mean, it's different if it's family, I guess, you know, if you're want to see grandma or something like that, or see a child, you know, one of your children. I don't know. Maybe it should be on a case by case basis. I don't know.
But it's not any different if you got a graduate that's graduating from high school today and they can't have a graduation party. I mean, I think the problem is everybody's going through some sacrifices they don't want to do. And I'm just concerned that if we open it up, that we're going to have more exposure. Call me a fuddy-duddy or whatever, but I'm not too tripped on doing this yet. Not at this point.
You know, as far as the vacation thing, I mean, we can put in, we can lessen the restriction, and then if something happens, you have to pay for it afterwards. I mean, there's that. I mean, we could go that way. I mean, you know, I guess I look at it this way. We're staying home, but if anybody else wants to risk going out, go right ahead. That's up to you. I'm not going to do it. If you come down with the virus, you're responsible for making that move. So it's almost it can be just an individual thing too.
Okay.
So we'll talk about that again on the
13th.
13th.
13th,
Same day, we're gonna talk about
The
possible
courthouse.
reopening date.
we revisit that at that time. And like I said, information is king. It's a matter of getting the correct information. Because I know there's a large segment of population out there right now that are saying that they've waited long enough, and they're going to push, and they're going to push hard. So we know that's coming, and that's a factor we have to factor
Yeah.
into.
So, I mean, either way, you just have to, if you're gonna pay it out or carry it over, just a decision has to be made as
Right,
to.
right.
They can't go, then that's our biggest question that we're getting from other people asking what the county's doing about vacation. So,
I've had 2 supervisors ask me about that.
Well, Courtney, have you heard of what other counties are doing?
As far as,
Could you do a survey on that, see what they're doing about vacations for next week then? So we have that information.
yeah, I can send something
I
out.
personally would sooner see us not let them, I don't like this, but I would sooner not allow them to leave for on vacation right now. Leave our policy that we have in place, but if they can't get their vacation used up, I would sooner see it that we do a one-time extension, and then it gives them that next year they got it, and give them, they have to use up next year. So we don't create ourselves a big liability. But I'd sooner see us do that, extend it. I'm just concerned that people move out, we're gonna have more exposure, and it's gonna be at a cost of our other staff and the taxpayers. That's the concern I have.
My concern is mental health of employees.
Exactly.
You know,
That's starting to be a big factor too.
I know everybody's making sacrifices, but
mhm.
you can certainly limit where they go on vacation.
Yeah.
But I think you still have to allow them to take the vacation, and obviously if they're just gonna stay at home for a week, at least they're getting out of the office for that week. But
If this county wouldn't have been one of our hotbeds, I probably might have went today, but
sure.
I'm not going to go down to that one. It's been a hot one since it started.
You just don't know.
So
No one wants to be the one to bring it back.
okay, any other topic? Oop, we lost Neil again. You might be back in the shouting match to be over. Anything else? Daryl, do you have anything else? Courtney,
Good.
Jean. All right. Paul, we care about you. All right. Take a motion for adjournment.
So moved.
I'll second.
Okay,
Thank
all those in favor say aye.
How all,
I.
Aye.
Aye.
nobody wants to be the first.